Thank you. I'll start it off with respect to the trust fund. Now, the president and Democrats are committed to protecting what we've always called Medicare's guarantee. Medicare is not some kind of voucher. It's a guarantee of high-quality health care, and Americans have earned this benefit with each paycheck. So with this budget, the president is focused on making sure billionaires and the very wealthy pay their fair share. We'd strengthen Medicare's negotiating authority and lower the price of more prescription drugs and extend Medicare's solvency for 25 years. Now, what we're hearing from the other side is giving a free pass to billionaires. All these budgets work it out so that billionaires basically are left untouched. And now we're seeing the full faith and credit of the United States being threatened. So what I'd like to do is make sure that you have a chance to make it clear what the differences are with respect to these issues. The president's budget, in my view, does not cut Medicare benefits by taking steps like raising the eligibility age, reducing access to care, or basically just handing everything over to a bunch of big insurance companies. Is that factually correct?
Senator, the president made it very clear. Senator, the president made it very clear. He will not propose any budget that cuts benefits under Medicare for the 67 million people who today count on Medicare and to the millions more who are added every year. He would, in fact, increase benefits at the same time that he's strengthening the program for the future generations to come. And so it's a proposal that was due because so many presidents have come before President Biden and never offered a proposal. I, for 24 years in Congress, never saw Congress try to tackle this in a serious way. Finally, we have a president who says, here's how we do it, and we can not only strengthen Medicare, but we can do it without cutting one benefit for any senior in America.
All right, let's move on to prescription drugs and the implementation of the Inflation Reduction Act. And I think you heard me mention right here in this room with Senator Grassley, Senator Stabenow was here, Senator Crapo was here. That's where we locked in the first ever set of financial penalties for price gouging in Medicare. And we saw the benefits of this week with the reductions in coinsurance. That's going to be of help to millions of people. That was done in 2019 in this room in a bipartisan way. So we want to keep building on that. CMS is working on a tight timeline with respect to the drug pricing reforms. And there's a lot to do in advance of the September 1 announcement, of which 10 drugs will be the first to go forward on the negotiation process. Last week, as I indicated, was an important milestone with the release of the proposed Medicare price negotiation guidance. This is in addition to the implementation of the penalties for price gouging. And you and I have talked about that. It's so important that the Inflation Reduction Act guidelines are met, and we ensure that the people who are participating in this program are ready and that the law delivers for seniors and the public. So my first question to you, and you and I have talked about this, is it possible for you today to commit to a timely release of the final negotiation guidance, which would come about this summer?
Senator, that's our goal. We've never done this before. We thank you for the resources to try to do it right. We understand that September is a magical date when we announce the 10 drugs that will be part of the first negotiation. We will continue to work with you. I'm committed to make sure that each and every member in the Senate and the House has the information they need to see where we're going. And because you were gracious in giving us the resources to staff up, we hope to not only meet the deadlines, but hopefully beat them.
We look forward to working with you really month by month to meet this September deadline. And you and I have talked about this before. This was an extraordinary victory for the millions of seniors who would stand in those pharmacy lines and felt like they were getting mugged by the prices. And pharma, protected this ban on negotiation like they were protecting the Holy Grail. And Senator Stabenow and so many others, kept making the case. Of course you ought to negotiate. There are more than 50 million seniors on Medicare. Who in the world doesn't negotiate? So last week's announcements were very good with respect to price gouging, with respect to the list for negotiation. We're moving ahead to make sure this gets implemented. Tell me a little bit about what the American people can expect to be told as this goes forward and how it impacts them, and then I'll yield to my colleagues.
Mr. Chairman, I believe we're going to not only be transparent with you and your colleagues, but with the American public of how we're going about selecting those drugs, the process in which we are going to engage the manufacturers in this. We want them to be able to participate as much as possible in a public setting so people can see how they behave in this process of negotiation. And let's let the American people see. Sunshine is the best disinfectant, as they say, and we have no problem with that.
Very good. Thank you.